From the JAMA Network, this is JAMA Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinion featured in JAMA.
I'm Dr. Gregory Curfman, the executive editor of JAMA. And in this JAMA author interview, I'll be speaking with Dr. Stephen Woolf. Dr. Woolf is a professor in the Department of Family Medicine and Population Health at the Virginia Commonwealth University School of Medicine. He is the author of a Viewpoint article, now published at the JAMA website, titled Increasing Mortality Rates in the U.S., but Not from COVID. Thank you very much for joining us, Dr. Woolf.
It's a pleasure to be with you today.
Now, Dr. Woolf, in your JAMA Viewpoint article, you've written about mortality rates and causes of death among adults in the United States. And I wonder if we could begin by asking you to tell our listeners why you undertook the study, what was the important clinical question, and why you decided to undertake it at this particular time.
Before the COVID-19 pandemic had struck, for about a decade preceding the pandemic, we had been tracking what we call the U.S. health disadvantage, the fact that Americans die earlier and experience greater disease rates than people in other high-income countries. That problem had progressively been worsening as we were leading up to the pandemic. Life expectancy had flatlined, but it was continuing to climb in other countries. The reason U.S. life expectancy was failing to increase was rising death rates in young and middle-aged adults. And this was getting some attention in the literature just before COVID-19 came along. When the pandemic arrived, obviously a lot of our focus turned to the mortality and huge losses in life expectancy that were occurring at the height of the COVID-19 pandemic. And our research had shifted to documenting the excess deaths that were occurring in the United States due to COVID-19. We published several papers in JAMA on that subject. As the pandemic has waned, there has been more and more talk about returning to normal, rebounding life expectancy, getting back to baseline. And what I had consistently told reporters who were interviewing me about this is that returning to where we were before the pandemic was not a very good place. And the concern was that as COVID-19 mortality rates have subsided, can we see whether those secular trends that were going on before the pandemic continued to claim lives? We suspected that they did, and the study was conducted to document what had happened with mortality rates from these non-COVID causes during the pandemic.
I wonder if we could turn now and have you tell us about what you consider to be the principal conclusions of your Viewpoint article and underscore these conclusions for our listeners.
The short version is that what we suspected, unfortunately, turned out to be the case, that the secular trends that preceded the pandemic had indeed continued during the pandemic. Death rates from non-COVID causes continued climbing, and in fact, the pandemic poured fuel on the fire. Many of these leading causes of death that were on our radar before the pandemic, such as drug overdose deaths, alcohol-related deaths, obesogenic diseases causing deaths from diabetes and other causes, accelerated and increased at a higher rate than they were before the pandemic. So some of the principal findings of our study has to do with these increases in drug overdose death rates, alcohol-related diseases, suicides in young and middle-aged adults, particularly alarming young adults, 25 to 44 years old, experiencing significant increases in deaths from these causes. Some people refer to these as deaths of despair. Deaths from drug overdoses, alcohol, suicides fit that description. But I'm not real fond of the term because what we see in this research is that mortality rates are climbing in this age group for a variety of conditions that affect multiple body systems and have etiologies that are unrelated to despair. So, for example, the article talks about increased death rates from neurologic diseases, from diabetes, from hypertensive disease of the heart and kidney, pregnancy complications. Too many causes to blame on despair alone.
Were there any surprises in your research for the Viewpoint article in terms of the main findings regarding mortality rates and specific causes of death? Anything that you didn't expect?
Well, I think I had some wishful thinking that maybe as we looked at the data, we might have discovered some good news, that the trends might have abated some. In fact, I was stunned by how dramatically they've continued to increase. And a pattern that we saw before the pandemic, the pervasiveness of this problem, the way it can be seen across body systems, across pathogenetic processes, came through again in a very dramatic way in this analysis. Just how many causes of death we're seeing these increases in mortality rates. I think the other concerning finding in the study that I wasn't quite prepared for was how many of these increases in organ-related diseases involve young people. Diseases that I would typically think of as making their clinical appearance in middle-aged or among older adults are now increasingly causing not only health problems and morbidity for young adults, but actually cutting their lives short.
Now, my final question relates to the clinical impact of the conclusions from your study. How do you believe your study will affect public health policy, population health, or particular aspects of clinical practice that might be of particular interest to practicing clinicians?
Well, that's a really interesting question. One way to think about this is that we need to pay increasing attention to the root causes. So when I say that there's a pervasive problem where death rates are increasing across multiple categories of disease and injury, we can think of the usual suspects as to what might be contributing to this. The obesity epidemic, for example, could help explain increases in death rates from diabetes or from hypertensive disease. The opioid epidemic could help explain the increase in drug overdose deaths. Many of the deaths that have increased in this age group are related to firearms. So the problems with gun control and safety legislation are obviously pertinent here. But when you see a trend that cuts across so many causes of death and that involves so many different body systems and different areas of injury as well, it becomes more and more important to think about systemic causes that may be at the root of this. Some of these are not the concerns of clinicians. So for clinicians, seeing patients at the bedside, where our findings, I think, are important is about the need to be alert to the, as I was talking about earlier, early age of emergence of hypertensive heart and renal disease. We saw significant increases in deaths from liver disease in people 25 to 44 years old. A lot of this likely related to alcohol. But again, occurring at least at an earlier age than I'm accustomed to from my training. Neurologic disorders occurring not in the elderly, but in young and middle-aged adults to the point that it is affecting their mortality. Obviously, obstetricians, family physicians need to be locked in to the issue of rising pregnancy-related mortality that cuts across much of the population, but is disproportionately affecting Black and other women of color. But for the public health community and for society at large, there's a larger question here of what's going on that is causing these kinds of systemic effects affecting our death rates across multiple causes. Life expectancy in the United States is much shorter than it is in other high-income countries. Other countries have rebounded from the COVID-19 pandemic and seen their life expectancy increase while it continues to struggle in the United States. And many of these patterns that I've described in this study, the rising mortality rates in young and middle-aged adults, are not occurring in other countries. This is a uniquely American phenomenon. So we need to figure out what's causing that and deal with those root causes.
Well, your Viewpoint article is quite fascinating, and I recommend it highly to our listeners. And I want to thank you very much, Dr. Woolf, for giving us your perspective on this very interesting research on mortality rates and causes of death in the U.S.
Well, thank you for your interest in the study.
This JAMA author interview was produced by Shelley Steffens To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. I'm Dr. Gregory Curfman, and thanks for listening.